At times during my recovery, I felt worthless and thought nothing I did was good enough. Early into my recovery, I displayed impulsive and risky behavior. During your recovery, it is reasonable to be sad, frustrated, or angry. You may struggle with controlling your emotions and possibly experience bursts of anger. Brain injury survivors also have to go through a grieving process as they let go of their old selves and get to know the new person they are becoming. Brain injury can also increase your risk of developing anxiety and depression. Some common behavioral symptoms after a brain injury are irritability, grumpiness, bursts of anger, mood swings, anxiety or fearfulness, apathy, low motivation, lack of self-limitation, easily overwhelmed or overstimulated, symptoms of depression, hopelessness, sadness, guilt, grief, loss of sense of self, change in personality, impulsiveness or loss of inhibition, lack of self-awareness, poor judgment, post-traumatic stress, nightmares. Don't suffer through these symptoms alone. Please get the help you need because you and your brain are worth it. Would you expect someone to think more positively to stop themselves from having a heart attack or having their appendix rupture? No, you would expect that they would get treated by a specialist. Mental health is a medical condition that warrants the same kind of care. When you seek a specialist, ensure they have experience and training in caring for people with brain injuries. A psychiatrist is a medical doctor who can determine your mental health condition that has been brought on or worsened by your brain injury. They can prescribe medications to treat various mental health disorders and behavioral issues. They can also help treat difficulty with sleep or sleeping disorders. A neuropsychologist can screen you for additional compounding mental health conditions and identify post-traumatic stress disorder. A neuropsychologist will teach you strategies that will help you cope with daily challenges. They can also test and measure your intellectual, cognitive, vocational skills, and identify your personality characteristics. A brain injury does not only affect the survivor, its impact ripples into the person's family life, work, and circle of friends. When your behavior starts to cause conflict within your family, consider acquiring the help of a family counselor. You can also think about participating in a support group for brain injury survivors and their caregivers. Changes in your personality and behavior after a brain injury are one of the hardest symptoms to overcome when healing from a brain injury. For most people, the symptoms resolve early in their recovery. For me, the changes in my personality are permanent. If your personality and behaviors persist, don't suffer alone. Seek the help you, your family, and your brain need. Get better, get stronger. Take care.